Hello everybody, welcome back to my channel. Thank you for liking the content that I made. When you like the video, share it with your friends, subscribe to my channel. I feel happy. It keeps me motivated to make more YouTube videos about OSCE. And then as you know, my channel provides information about OET, OSCE, CBT. So particularly nowadays I'm making stuff about OSCE, how to prepare the skills, how to do assessment, planning, implementation and evaluation, and how to complete the skills within the time limited. They give limited time, right? So we need to do it within the time frame. And then my aim is to help overseas nurses who come to the UK and then feels that it's overwhelming for them to prepare for OSCE, because it's the time when they are new in the country, they are adjusting to the environment, and that's why I feel like that's the time the overseas nurses need the help and support most. So let's start the video. Our today's video is about catheter specimen of urine, how we take the specimen of the urine from the catheter, and how to do it correctly. Let's start the video. So guys, just to let you know, I have a YouTube channel, a YouTube video about catheter specimen of urine, how to complete it in the time, and it's an audio video, but it will give you an overview how you do it in the exam. And I'll put the link below in the description box. You can check and watch that video about catheter specimen of urine. That is the video I prepared when we were still preparing for OSCE. Yeah, so it will be good. It will be worth watching. Here you need to know what are the things that you need in the catheter specimen of urine skill station. You need alcohol swab, you need gauze, and catheter what do you call it, a universal specimen container. We need non-sterile gloves and apron that we need to wear, and what else, the clamps. If there is no urine in the catheter, we need to clamp it. We need that clamps and 10 ml syringe. Yeah, let's start the procedure. So guys, after maintaining patient privacy, cleaning your hands, I mean after the pre-procedure, you are going to introduce, as you know, after introduction you need to prepare your items that you're going to take with you. So what are the things we need? As I said earlier, you have checked all those things. You have checked the expiry date, you have checked they are not damaged, and they are still in date, and then we're gonna use them, right? We have prepared all the things. And for the urine specimen container, you need to know if it's labeled. If it's not labeled, you are going to only label it at the patient bedside to avoid any mistakes in the patient ID. You have prepared all the things and put them on the trolley, wear your apron, and then take it to the patient bedside. So as I said earlier, we are going to start with the actual procedure today. We have taken all the things. We are at the patient bedside. We need to perform hand hygiene first of all. We are already wearing our apron. You can wear your gloves now, and then explain to the patient that I'm going to take a urine specimen from your catheter, and then that you need to tell them that I'm also going to expose you a little bit. Curtains are around. I'm maintaining your privacy, and then I'll expose the area only needed. You don't need to expose the private part, because we are taking the sample only from the sampling port. We don't need to see the catheter inside. We don't need to expose everything. Yeah, so just look at the catheter port, the sampling port. You need to know the sampling port, guys. I know there were incidents when we were preparing for OSCE. One of my colleagues, she took the sample from the catheter balloon itself. You know, we insert 10 mils at least to inflate the balloon. They took the sample. She took the sample from there, and that is a big error. Make sure you know the sampling port. If you're not sure about which one is the sampling port, I can show you the catheter and its specimen port next time. Let me know in the comment section if you haven't seen it before. So you need to take the sample from specimen port. Look at the sampling port, look at it and see if it's clean. Yeah, but still we need to clean it before we take the sample. We need to clean it with the alcohol swab as one go. So we need to clean it. As I said, we have checked it's clean. We have cleaned it with the swab, and now we can look that if there is a sample, if there is a urine in the catheter, that's well and good. If not, we need to clamp it and wait for at least 5 minutes for urine to be collected. Yeah, so if you clamp it, make sure guys you remember to unclamp, otherwise it is gonna rupture the patient urethra. So make sure you remember that, remember to unclamp it. You would be thinking where to put the clamp. You need to put the clamp few centimeters distal to the sampling port, just below the sampling port. Nowadays we use the needleless system to withdraw the sample, because the catheters, they come with the sampling port. But before, if you don't have the sampling port in the catheter, how you gonna take it? You're gonna take it with the syringe and needle. Yeah, so using the sterile syringe, you need to insert the needle at 45 degrees, yeah, to the catheter, and then withdraw 10 mils or whatever amount you need. Usually it's 10 mils. And if you are using the needleless system, we have cleaned the sampling port. You're gonna take 10 mil syringe without touching the tip of the syringe. Yeah, you don't need the needle, you don't need a needle with the needleless system. So you're gonna open the syringe, insert it at the sampling port, and then withdraw 10 mils. Yeah, after taking 10 mils, what are you going to do? You are going to transfer the urine from the syringe to the sampling port. I think I would show you with the catheter, guys, because taking sample from the sampling port can be confusing, and then there is a procedure that you need to follow. You need to hold the 10 mil syringe into your hand, and then at 90 degrees firmly you are going to insert into the sampling port, and then withdraw 10 mils of the urine. Yeah, then you're going to transfer it to the sampling port. Let me know in the comment section if you haven't seen that catheter before. I'll show you in my next video, guys. Yeah, be honest, if you haven't seen it before, I can show you. I'll just make a video at work. Yep. Okay, and then now we have taken the sample. We are going to transfer it into the sampling port. Here, one point you need to remember: do not contaminate the edges of the tube, the edges of the specimen container, by touching the syringe with it. I know we try to make sure that our syringe is sterile, it's clean, but again, that you need to remember that you're not touching the syringe and the container with each other. We need to maintain sterility. That's the most important point in catheter specimen of urine. We are not infecting the urine specimen here. We need to maintain sterility at all points. Now we have poured the urine into the specimen port. We have closed it. We have closed the lid tightly, and then put it in the specimen bag, and then keep it aside. Next point, we are going to discard. If you use the needle, discard it into the sharp bin. If you have used the syringe, discard it into the orange bin right away. Then you need to clean the sampling port again. You need to clean the sampling port again, and then cover the patient and tell them that I have taken the sample and I will send it to the lab. When you clean the sampling port again, you need to make sure it's dry before you cover the patient. And then you need to just dispose of all the things that you have used. You need to remove your gloves first, and then your apron, and then wash your hands thoroughly, because you were doing a procedure which contains patient secretions. So make sure you wash your hands before you go off. You need to tell the patient that I will send the sample to the lab as soon as possible, within 4 hours, or I will refrigerate it at 4 degrees in the fridge. And then also you need to tell that I will label the sample, and then I will state your clinical condition on the form. I'll complete the microbiology request form, and then I will send it right away. And also tell them that I'm going to document in the system or in the paper, whatever method you're using for documentation, that I've sent a urine sample for this patient. Now we have taken the sample. Our procedure is complete. We have checked the patient ID before. When you prepared everything and you took to the patient, you need to double check the patient ID and all the details with the container if it's labeled. If it's not labeled, you can do it at the patient bedside, and then check the patient ID if you are taking the taking the sample from the right patient and from the right catheter. Okay guys, so now our procedure is done. You need to dispose of all the things, make sure your documentation is complete, and then your patient is safe before you leave. Put the side rails up if they need it, and then ask them if they are comfortable, if they need to drink, if they need a loo or something, yeah, before you leave the patient. And then you withdraw the curtains earlier, right? Make sure you just remove the curtains back, and then explain to the patient if they need anything, let me know. So as you know guys, if there is urine in the specimen, if there is urine in the sampling port or into the catheter, we don't need to clamp it. But if you clamp it, make sure you remember to unclamp it. Yeah, remember to unclamp it. What if you forget to clamp? What if you forget to unclamp and then you leave the station, you leave the examination room, and then on the way home or on the way back to your home you remember that I forgot to mention that I forgot to unclamp the catheter? You can still go back. You can go back, tell the assessor, knock their door, ask them, apologize, and tell them that I forgot to unclamp the catheter. I will do that. I will make sure that I remember in the real setting to unclamp, and what you're gonna do in the clinical setting. Yeah, even it's late already, just go back and tell the assessor. It may increase your chances to get a pass. Okay guys, so that's it for today. I hope this video was helpful and informative. If you like the video, share it with your friends and colleagues, and then please like, comment, and let me know if you need any kind of support with preparing your Osce. Thank you so much. Have a good day.